I've worked at several other really major cancer centers in the country, and I've visited scores of others. I would say Duke just has a very unique feel. Maybe it's because it's the South. Maybe it's because we're right on a university campus. Maybe it's because we have such a a diverse and accepting and gracious patient population. Whatever the reason, this is really a place that inspires me. Some of the work that we've done, questions around real-world experience of patients. Patients not necessarily on clinical trials, but on the work that, we just don't understand how these populations of patients are going to respond to therapy because they've never been studied. And we have opportunities where we do that in patients that wouldn't qualify for clinical trials. And we learn from that information. When we think about some other disenfranchised populations, like our Black or African American populations, we've done some seminal studies looking at differences in therapy by race. And the things we've uncovered never would have been known because no one else was doing those studies and still haven't. To me, it's incredibly gratifying when we're able to offer to the field of medicine, to the world, and to our community right here in Durham, some insights that are otherwise lost or missed. When I look at our fields and just how our therapies have turned over, it's incredibly exciting. But how we use those therapies, it's one thing to have them get FDA approved. It's another thing in how we learn to use them in combination or sequence in patients. And that's the real art of medicine. And that we learn from a collective experience. And we do something called tumor boards, where we review our experiences with each other and our patients and present some of our challenging cases. And to me, there's really nothing more rewarding than when we put our collective experiences together and we find a pattern, or we identify an unmet need or an opportunity in the field to do something different and to see a better outcome.